Beneath the beautiful landscapes of Tanzania, an inspiring tale of triumph emerges in the battle against COVID-19, driven by the extraordinary efforts of the Saving Lives and Livelihoods initiative, a bold partnership between MasterCard Foundation and Africa CDC to safeguard the health of millions of people and hasten the economic recovery of the African continent. In collaboration with the Ministry of Health, the Saving Lives and Livelihoods initiative started implementation activities in Tanzania in 2022, administering over 5 million vaccine doses and fully vaccinating the eligible adult population. Tanzania's efforts alone have contributed to a significant 15% of the program's overall targets in 25 countries. This program's success is rooted in effective governance, strategic partnerships, and reliable in-country logistics.
At the initial start, we had a lot of challenges, but the major challenge was the vaccine acceptance in the community. The acceptance was very, very low. So as the government, we decided to come up with a strategy of accelerating vaccination program, and that acceleration program was community-based. So together with the coordination partners and continuing with the evaluation, by December, we were able to reach 100% of the target population nationwide.
The success in Tanzania is undeniable, as the country had a delayed approach in implementing COVID-19 response interventions. However, it now emerges as a leader in COVID-19 vaccine uptake. At the national level, the Ministry of Health was instrumental in coordinating the implementing partners and sub-national levels and providing strategic guidance. With the Tanzanian government scaling up risk communication and community engagement, the demand for vaccines has increased and hesitancy and misinformation have been significantly reduced.
We used it to implement different strategies which were geared to promote acceptance, trust, and uptake of the COVID-19 vaccines in the country. So we used it to deploy community volunteers, community leaders, and healthcare workers, or the vaccinators, working together, going together to the communities, reaching out household together, and at the same time sensitizing communities and delivering vaccines to those who uptake. The other strategy which we used is the event-based COVID-19 vaccine sensitization approach, where we could create different community-level events, working with volunteers, community health workers, and leaders at different levels to disseminate COVID-19 vaccine messages, address rumors, and at the same time provide the services.
Nimehamasishwa na African CDC kuja kuchanja chanjo ya COVID-19. Kwa hiyo nawashauri vijana wenzangu waje wachanje na wenyewe chanjo ya COVID-19.
The introduction of Saving Life and Livelihood came to Katavi. Political leaders, local leaders, and community health workers, when they all get on board and they spread the message to the community, then we start seeing the rising of acceptance, and we came from 49% to more than 130%.
Following the achievement of its vaccination targets, the Tanzanian government is now integrating COVID-19 programs into routine health services and immunizations.
We are doing an integrated COVID-19 vaccination with routine immunization and primary health care services. Why are we doing this? It's because during the acceleration of COVID-19 vaccination, we missed a lot of primary health care interventions, including routine immunization, and therefore many of the eligible children went without being immunized during the era. And we came to realize this by experiencing some outbreaks like measles outbreaks, rotavirus outbreaks, which happened at the starting of this year.
The SLL program is supported by CDC, and the implementing partners, the AMREF, Red Cross, and WFP, had benefited the Tabora region in immunization services. The program was aimed to increase coverage of the COVID-19 in the region from 71 to 100% of the national target which we had in Tabora region. We attained the 110 target of the COVID-19 vaccination. This was one of the benefits of the program. Secondly, we had a challenge in distribution of vaccine and supplies across our councils and the facilities. The SLL program enabled the region to distribute the vaccine on timely basis. The SLL program facilitated the activities on a quarterly basis, and especially when we had campaign programs, all these were used to supervise and mentor the vaccinators across all the health facilities. Before the SLL started, we were at 20% of the data entry, and currently we are 62% of the data, all the COVID-19 vaccine. The SLL has supported the Tabora region to fight the measles outbreak, which occurred across all councils in Tabora since October 2022.
Katika mradi huu ni mchanjaji wa COVID pamoja na surua, pamoja na rota, vitamini A, DPT na polio. Katika mradi huu wa uchanjaji wa COVID nimeona unasaidia sana watu, na watu wanaitikia kuja kuchanja, na wengi wamechanja na bado wanaendelea kuchanja. Nimeona watu wana mwitikio mzuri na hata leo watu wamechanja.
Mradi huu umetufanya tufikie walengwa wetu, lakini pia umetufanya tufikie walengwa walioko pembezoni, kata jirani na sisi. Tukifanya kazi hivyo tutawafikia hata wale ambao hawajui umuhimu wa chanjo. Na ni wengi tunawapata tunapoenda mtaani. Tunakuta mtoto hajapata chanjo hata moja. Ni kwa sababu hajui umuhimu wa chanjo. Na mwingine bado wanakuwa na zile imani ambazo zinawafanya wasilete watoto kwenye chanjo. Lakini kama tutapata wahamasishaji wengi wanaweza kwenda kutoa elimu mtaani, wataweza kuwatoa wale wenye imani duni kuja kuchanja.
The Saving Lives and Livelihoods initiative goes beyond COVID-19 vaccine procurement, focusing on efficient vaccine management and distribution, risk communication, and workforce development, ultimately strengthening public health systems in Africa. By engaging community leaders and addressing local and cultural factors, vaccine hesitancy has been reduced.
Mimi kama mkuu wa wilaya, jukumu langu la kwanza kabisa ni kuhakikisha usalama kwa wananchi wa wilaya Mpanda ili waweze kutekeleza majukumu yao ya kazi ya kila siku. Kwa hiyo moja ya jambo ambalo nalikazania kwa wananchi wangu ni kuhakikisha kama zipo chanjo, hizo chanjo wanazizingatia kwa wakati. Na moja ya chanjo ambayo tumekuwa tukifanya sana kuhamasisha wananchi wetu kuichanja ni pamoja na hii chanjo ya corona, kwa maana ya kuwafanya wananchi wetu waweze kujenga kinga ya mwili, waweze kukabiliana na maambukizi ya huu ugonjwa wa corona ambao ni ugonjwa mpya.
Tanzania's remarkable success with the Saving Lives and Livelihoods program underscores the power of effective leadership, strategic partnerships, and integrated approaches in combating COVID-19. By working together, we can save lives and pave the path to a healthier future.
Generally, the experience with COVID-19 response under SLL project is a key contribution to the country, as we can narrate from the point when we had high hesitance to uptake of the vaccine, and to the point when every individual would see taking vaccine as a normal issue and would have high acceptance.
Get vaccinated today. COVID-19 remains a public health threat. Protect yourself, your loved ones, and your community.